Hi, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and also the host for the Dean's Chat podcast. Here with my co-host, Dr. Johanna Richey. Hi, Joe.
Hey, Jeff. How you doing?
I'm doing great. How you doing?
Oh, it's a beautiful day here in Arizona.
Yeah, and then we're doing an in-studio episode.
In-studio. It's always exciting.
With our colleague from the school, Dr. Jana Kraleski. Hi, Jana.
Hi, good to be here.
Thank you for joining us.
Thanks for having me.
Sounds good. We're pretty informal on Dean's Chat. So we got the three J's, Jana, Joe, and Jeff. How's that sound?
Sounds good.
All right. So for our audience, last week we finished another academic year and we had an awards banquet and we had the graduation. What'd you think of it all, Jana?
It's great. It's always my favorite time of year, watching those students that, we spend 4 years teaching, welcoming them as colleagues. It's the best part of my job. I love it.
I love it too. So you were in practice before you got into academics.
Mm-hmm. Yep. I was in private practice for about 6 years, and then started working at Midwestern part-time, just 1 day a week. And then within a year, a full-time position opened up, and it's been awesome ever since.
So you have a unique role at the college. You spend more time at the clinic than you do in your teaching or academic position, yet you carry a huge academic load.
Yes. But I love my classes.
We're going to have to talk to your dean about that. No, I know you do. But our students just so much, they love working with you. The suture off, the competition is one of the highlights. Can you talk, we're going to talk about your whole career, but I think that's one of the neatest things that we do at the college. Do you mind sharing with our audience through your class how that came about?
Yeah, it's our first year introductory surgery course, and it's focused on surgical skills, very heavily lab-oriented. And one of the motivating ways we get students to actually go home and practice their suturing techniques is we make it a competition. And it's really fun at the end of the year. We do it in kind of like a March Madness bracket type of thing. And then by the end of the year, we have a big party, invite their families, and we have a head-to-head competition. It's fantastic and motivating. They all love it.
And the winners always put it on their CV.
That's right.
Justifiably
That's
so.
right. And they get a very good letter of recommendation from me.
And it's great because she makes it hard, like for the actual event where they'll put oil on their hand. Because, in the operating room, blood gets sticky, fat is oily. So it simulates real life situations. And I just think it's fantastic.
Yeah,
the students love it.
They get gowned up, gloved, everything. They're nervous. They're shaking. It's hysterical.
So we have graduation is a big day.
Yeah.
Match day is a big day. The suture off is a big day. Mm-hmm. And white coat ceremony.
Yeah.
All right. So we have a lot to talk about today, Jana. I know that you are a second-generation podiatrist. Mm-hmm. And do you mind sharing with us how you got introduced to podiatry, but share some stories about your dad. Dr. Malillo was an icon in our profession.
Yeah. Well, it's funny because growing up, Dad would take us to the conventions, the APMA lecture every year. Those were our family vacations. And I remember going through the exhibit halls to get all the free stuff and the lollipops and the pens. But seeing the pictures of the wounds and the surgeries, totally grossed out, had no intention whatsoever of becoming a podiatrist. And it just kind of worked out that way. I thought I wanted to be a researcher. So after undergrad, I went to Eastern Virginia Medical School to get my master's degree and realized that working in a lab is really, really boring. Just so not for me. It was so isolationist. We were working a little bit too with controversial animal research and just wanted nothing to do with it. So then we moved back to Ohio from Norfolk, Virginia, me and my husband, because he got into law school up there. And I was just kind of free-floating, wasn't sure what I wanted to do. And my dad, who was the president of the Ohio College of Podiatric Medicine, said, we have a legacy scholarship. Why don't you just start your first year here? You can, because at the time I was thinking maybe I want to go to medical school. He's like, just enroll, take some classes, see how you feel. And by the end of the first semester, I knew it was absolutely what I wanted to do. I loved it. Yeah.
Wow. So you didn't hang out in your dad's office when you were a kid or anything like that?
No, Dad's work was fairly separate from Dad's home, but he definitely took us. He was very involved in the lecture circuit, especially earlier in his career. And so we always went to the podiatry conventions. So a lot of the icons in our profession are my uncles.
I bet.
Josh Gerber, Uncle Josh, everybody, they're uncles.
You knew Bill Todd, too.
Yep, Uncle Bill. Yep.
Bill was my residency director, as a small world that it is.
Yeah. Yeah, he was at the Ohio College fairly early, so I was a real little girl, and he used to bring his dog, was it Bear?
I think so.
He had this huge dog, incredibly well-trained, terrifying, but this thing, I mean, knew voice commands, and it was awesome. He was a neat guy.
He was a neat guy. When I was a resident, he called me one day and he said, Jeff, what are you doing on Tuesday? And I laughed. I thought, I'm working, right? I'm in the OR, I'm in the clinic. He goes, no, I've got a reservation for us to go duck hunting. I'm like, really? I'm in. And so that was kind of a funny story. We were shooting pool and drinking beer one night, and 6 o'clock the next morning, he was yelling at me about something.
It's a good residency director.
There you go. There you go. All right. So you went to school at Kent State, fell in love with podiatry. But aren't your brothers a podiatrist also?
My older brother, Tom, who's the second of 5, was the first. Yep, he was a podiatrist. He's practicing in Portland. He's associated with the Legacy program. And then me, and then my younger sister. So 3 out of the 5 of us original Malillos ended up being podiatrists. One is an obstetrician, and the other one's kind of the black sheep. He does his own thing.
Oh, that's
But he's
funny.
the funnest one of all of us.
So I met your mom last year at the Podiatry Foundation meeting.
Yeah.
So what's it like now when you all get together with all these podiatrists around like the Thanksgiving table?
The rule of no talking about feet. Absolutely.
Who carves the turkey? That's
Yeah.
the real.
Oh, I like that.
Yeah.
You take
Mom, Judy,
Mom?
Judy does it. Judy is on it.
That was the funniest thing is residency dinners, like the Thanksgiving, who's going to carve the turkey? It was like the thing, like I'm going to do it better than you. Yeah, it's like, oh, guys, come on.
So where'd you do your residency program?
I did my residency program at the Cleveland Clinic Kaiser. It was a dual program. The first couple of years focused at Cleveland Clinic, and then the final year focused at Kaiser in Ohio, which now no longer exists. But it was awesome. It was absolutely such a wonderful experience. I had an amazing residency director, Mark Hardy, who's still involved with the program, even though it's not called that anymore. It's a university hospital system. But, I always talk to the students and residents, especially, that'll come and scrub in my cases, some of the VA residents. And, I always ask them, do you feel ready? Like when they're in their final year. And so many of them will say no. I felt so ready. By the end of my 3rd year, I was ready to go. I was very well prepared. It was an excellent program.
That's fantastic, which is a common theme in our profession, right? You go into residency programs and sometimes you don't really know whether you're going to feel ready or not after 3 years, which may have been part of the impetus for all these fellowship programs to start up, which is...
And it's good. If they don't feel ready, they can go after a fellowship, get that extra year or so of training, and feel more confident going in. Absolutely.
Absolutely. So your thoughts on being in practice and all you learned in practice prior to becoming an academician. Is that right?
Close enough. I love my job right now. Having both, so I'm not doing everything the same every day, being involved with the students on a daily basis, seeing their enthusiasm for the profession and every new thing that walks in the door. It's incredibly inspiring. And again, by the time graduation comes, watching them, go on to be the future of this profession, it's awesome. I don't think I'd ever go back to private practice.
Oh, I agree with you. Yeah. Joe, you were in a similar boat, right? You were in practice and you've been teaching a lot, but I think it really adds to your ability to interface with students in a way that says you've lived the real life, right? You've been in practice and you're helping them through their journey in school.
Yeah, and I have to say too, it's been really fun to work in the clinic with Jana because the opportunity to really focus purely on teaching is, I actually think, kind of unique to our clinic. Not that other university clinics don't also teach, because they absolutely do. But the fact that Midwestern, as a university, their primary goal is not necessarily a financial one. It is to focus on teaching, allows us that opportunity to slow down and let them have a chance to fully work up the patient, problem solve, but also schedule the clinic in such a way that we are not running around crazy all day, because in other experiences, it can be a little overwhelming to have students, because you either have to accept that you're going to sacrifice the cost of slowing down your clinic to teach, or you just book it in such a way that it's like, okay, you're going to see X, Y, and Z patient, and I'm going to see these 12 others while you're doing that. And at the end of the day, we'll recap. And those little opportunities for that one-on-one in the moment teaching can kind of get lost. And I've asked Jana to help teach me new things, like using ultrasound in the clinic and things that I haven't really had the opportunity. So she also gets to teach peers along with students, which, whether she wanted to or not.
Of course.
So Jana, last year you're both in the clinic. You're both teaching all the time. But Jana, you're there more than anybody else. 24 students rotated through for a month last year.
Yeah.
What's the difference between a student? Because oftentimes it's the beginning of their clinical experiences. What's the difference between day one and the last day of the month?
Oh, huge. They're so much more confident. I think because we know them, like with the preceptor model that we have, I do think it's difficult for a private practitioner to have a student come in and just say, go for it. It's their patients, they're responsible. And a lot of times the patients aren't very receptive to that. The nice thing about our clinic is they know it's a teaching institution from the minute they walk in the door, because it says Midwestern University Multispecialty Clinic. And so they expect it. And because they expect it, we can let them just do so much more hands-on. So from day one, they're doing the injections, the nail procedures, provided the patient's okay with it. And 9 times out of 10, they are. And I've heard from students multiple times, just the hands-on experience they get at the Midwestern clinics has been so helpful. So huge difference usually from day one. Now, by the end of the year, like the May rotation, they're all pretty experienced, but especially at the beginning of their 3rd year.
You've both played a big role in research endeavors at the college. And initially, students get introduced through posters, and they're introduced by patient experiences. Do you mind talking about working with students, not only for those posters, but you're also heading up the CME program where students are giving lectures and outside doctors could even get credits for them?
Yeah, so I really think that research, be it a poster, a case report, or original research, clinical trials, is a really important thing to continue to legitimize our profession. We're always talking about parity with the MDs and the DOs. And I think our profession's done a really good job of getting into the literature. And my dad, he was a big champion of that as well. So I provide a couple of opportunities. We have a monthly grand rounds where the students are responsible for compiling, composing, and giving the lecture. And it's for CME credit. And I think that's hugely important because in their 4th year rotations, they're often going to be asked to give some sort of presentation. And it gives them that experience in a relatively safe environment with their teachers that can give them constructive criticism. And then the posters, that's volunteer only, but oh my God, that's why we have so many poster submissions every year. I'll send out a blanket email and say, who's interested in doing a poster? And literally more than half the class responds. So we got to kind of go nuts and find different cases. But in general, they do such an excellent job. And it's great experience for them, just a little way to dip their toe into the whole research genre in an easy way.
I always think back to when we were students and, it seems like, you're giving a talk for CME. It seems so basic. But if you're a 3rd year student and you're doing all the research and you're preparing a PowerPoint and you're standing up and giving a talk, not only in front of your peers, but your superiors, doctors, that's a lot to ask. And they really do a good job.
They do. And it's a great experience because it's not only, your oral presentation skills, it's your literature review, your ability to do the literature search, validate the sources that you're using. Is this a good study? Is this not? And that's what I always tell them to focus on. Like, we don't want this to be an introductory lecture. We all know what flat foot is. We all know what Achilles tendon repairs are, whatever. We want to know, what's the literature say? What's the latest, greatest? What have the studies shown? And then based on all of that, I usually ask them to try to come up with some conclusion on their topic. This is the best fixation for this procedure according to this, this, and this. So I think overall it's just a good experience just to get them comfortable with how do I write a literature review? How do I research a topic? How do I find good articles for whatever subject I'm thinking about.
And I think it also sets them up to start asking those kinds of questions. Because if
Absolutely.
we just, be like, oh, pick a topic and write a presentation, what I really appreciate is that you give, and whether it's through like a guided discussion or it's like a very specific question, helps them start to problem solve. How would I find the answer to that? And then when they go out into residency, if they're going to go to a program that does research, they're already starting to think in more specifics. Like, well, we know about this. What is the unique thing about this procedure, this technique? And then is there something specific about that I can take it down this other direction? And so I really appreciated that they're very, helping them come to those more specific questions, not just give a lecture on osteochondral defects. To your point, we all know that. Like, give us something more than that. Yeah. So,
and usually that's the process. When they come to me, they'll say, "Oh, I want to talk about this," and then we'll spend some time. Okay, let's drill down. Yeah. What specifically do you want to talk about? Because this is a huge topic. Yeah. We don't want this to be a lecture. We want this to be informative and educational for practicing physicians, and that's our goal. And I think they do a good job of hitting it.
They do it. I think they're surprised sometimes when they're done giving their talk that their talk has stimulated all these discussion points among doctors that they look up to, their preceptors. And I think they're like, wow, this is really cool. And I hope that it stimulates them to do more research in the future.
Yeah, there's been multiple times where after they give a presentation, I'll be like, okay, can you send that to me? Because I want to use that.
Yeah, it's been, we have exceptional students, but I've been totally blown away what third-year students can come together in terms of like, wow, you just knocked it out of the park. And again, having the opportunity to give them that feedback, because they put a lot of, some of them will put a lot of effort into it. And so to have that pay off and get that feedback, and maybe those that didn't put as much effort have the opportunity to have that feedback, like, what do you think could be done differently? Those are this is the safe space to have that opportunity, not on your externship when you're trying to excel. So again, I just think that's such a valuable part of that educational process.
So I have a question for both of you, actually. It's so commonplace for all of us when we're in practice to think about giving a 1-hour lecture or, how hard can it be to teach kind of thought process. And Jana, you made the first foray into academics. It's completely different teaching a class than it is just giving a 1-hour lecture.
Oh, absolutely. Because they'll come up to you and ask questions and you have to be able to answer them. Oh, and then I think that's another, just such a good reason why I love my job. I have to keep up with the latest and greatest. I think in private practice, you're so busy, maybe you don't have time to read the latest journals, but I have to prepare for my lectures. And they expect me to know. I'm the expert.
And they'll call you out if you don't have something up to date. Be like, I just found this article
on Google.
Oh, that's wonderful. Let's talk about it.
Well, I know that whenever we're putting together courses and there's a director for courses and sometimes we lecture in each other's courses and things, it's just a different game putting together a lecture and keeping it up to speed, keeping it up to date with the latest and greatest in the literature. It's different than giving I guess where I'm going with this is it seems like academics seem so easy. It's not so easy.
I don't think so.
So I have a question for you in that, just in terms of like learning curve, like learning how to be a good clinical preceptor. What was that like for you when you started that?
I think just time management, like you were mentioning in private practice, it's all about how many patients can you see in a day, and because that's how you get paid, right? And here we are able to build our schedules, again, not with that focus in mind, but with teaching in mind. So there was a bit of an adjustment period switching from that mindset to, okay, now I'm here to not only treat my patients, but to teach. And just by, building that little bit of extra time in the schedule, just by getting that routine down of, okay, you go in and see them, then present. And then what do you think? What do you think this is? What do you want to do? Do you think we need x-rays? That whole process, which takes a little bit of time, but not, it's doable. I still see, 30 patients, 40 patients a day. So it's doable.
How was your experience?
Absolutely. I think it's been a fun thing to try. And I got into teaching pretty much right out of residency. And in some ways, I think that was wonderful because it forced me very early on to ask questions like, why am I doing it that way? Like, well, that's who Dr. So-and-so showed me how to do it. But that wasn't the only reason. So what was the other reason that I'm doing something the way that I'm doing it? But I think there is something to be valued, and you gain your own experience and expertise, and then you go into teaching. And so again, I don't think it's that one is necessarily better than the other. It's just, again, trade-offs and different experiences in terms of how you learn that finesse, how you take the noticeable time to slow down and ask, rather than answering the question, which I think in academics it's so easy. We get used to answering questions for people. And I don't want to answer the question. I actually want to do the annoying thing, ask you another question, right? Yeah. But it's such a good way to engage in that teaching process. Like, that's a really great question. What do you think we should? And again, you can see it. Like, they like that. Like, you throw the ball back, and they're like, "Oh, I want to take this and run." But it does slow things down. So finding that balance and finding that. And again, obviously, you're still very, very busy in clinic, so hasn't slowed you down too much, but just developing that skill set of finesse, as Dr. Yoho had talked about, of, getting the best out of both of those, and I think that's something to model for.
Absolutely.
Yeah, there's no doubt about that. I think there's a special skill that goes into teaching while you're seeing patients, and you're forced to do it in an academic setting. But like you said before, the preceptors have to find that balance. Mm-hmm. I think that's why it's important. We have got some of our preceptors are actual faculty, so they understand the goals and objectives for the students based on where they're at in the curriculum. I think that helps a lot. If you could ask the preceptors to focus on one thing more, what would it be?
Letting them get more hands-on. I think that's the most common complaint that our students say too. There comes a point where you just don't get that much from shadowing. Right. They have got to do the exam. If possible, they have got to do the procedure, or at least be an assistant on the procedure. Yeah, let them play with the ultrasound. Let them look at the x-rays before you do. Tell you what they think. Right. Yeah.
What do you think, Joe?
I couldn't agree more. Again, it's the things that, in fairness, when you look at it, like, how do we make that system work, right? If you are in a very busy practice that isn't willing to slow it down to have that kind of a teaching experience, how else can we facilitate that for students? And so making sure that students get a well-rounded experience, because I agree, like, there's a lot in shadowing and watching a lot of different people do it differently. But also, as a student, at some point, you watch 100 of these, you just start to lose focus on, like, I've seen 100 of these. Okay, here's somebody else doing an ingrown toenail. Yep, okay, check all the boxes. But then you hand it over, and it's like, I've watched 100 people do this, but I don't remember how to do it, right? Or I know how to do it, and I'm gonna shine because now I have the chance to do it. So I would mirror that.
One of the things I always notice in the clinic is that the students come out understanding what it means to work up a patient and develop a differential diagnosis. Mm-hmm. And I think that's one of the things sometimes that gets missed in fast preceptor environments about really, well, what is your differential diagnosis and why are we doing that? Yeah. So I think that's always something that you all do so well in the clinic. It's important. So, Jana, what do you do when you're not engulfed in podiatric medicine?
Laundry, cooking. No. I got 3 kids. They keep me pretty busy. Travel is mine and my husband's biggest passion. So we try to get at least one big trip in a year. We go down to Mexico quite frequently. But yeah, travel is our big focus, Joe and I.
I don't think people realize that when you live in Phoenix, you're only 3 hours from the Gulf of Mexico.
Yeah.
And you've gone down there for years.
We do. We actually have a place down there now. We like it so much.
You just don't. You think of the Grand Canyon. You don't think of easy access to the beach.
To a beach, right? But 2 hours from snow in the winter, 4 hours from the beach. It's great. Fantastic. Much better than Ohio.
That's true. Well, for this podcast purpose, it's definitely true. So another question that we all have: we're all involved in student recruitment. And we're always interviewing students and having discussions around, who we should offer an acceptance to. 2 questions. The first is, what are you looking for in a student? And secondly, what are you telling prospective students when they're contemplating podiatric medicine?
So the first thing I look for when I'm involved at interviews is confidence. If they can go in there, if they have, they can come right off the bat. And that just tells me they have put effort into this. They have put effort into prepping this. They have researched possible questions. You can tell when they're kind of like, wide-eyed and it's different than just being nervous. Confidence, just that preparation. And that just tells me they want it. They want it. They're serious about it. That's probably the biggest thing I look for in an interview. And of course, by the time we see them at the interview, we don't know their grades, but they had to have had at least the minimum to get the interview slot anyways.
To even get into the door for an interview, exactly.
Yeah. So that's the big thing I look for.
How about to prospective students?
The biggest thing, like in terms of what would I tell them, be ready for?
About podiatric medicine as a career?
The biggest thing I do, so when I go to some of these recruiting events, especially female students, I think one of the biggest draws for our profession is how modular it is. If you want a busy surgical practice, great, do it. You can be on call, you can take ER call, you can take trauma call. If you want to go 9 to 5, great, do it. You can literally make your career whatever you want it, so you can accommodate a family if you want to. I think that's the biggest draw for our profession. Plus, I think the biggest, I had mentioned I went to get my master's degree and I worked in a lab for 2 years. Monotony. And I think that's what drives most people crazy about their jobs. There is no way our job is monotonous. So, and I suppose you can say the same thing for any physician, but just the sheer range of problems we see, just the sheer range of procedures that we can do, it's never a dull moment. It's never boring.
I think that's why so many students, when they interview, report that I've shadowed all these specialties, and the podiatrists that I shadowed were the happiest of the group, because we've tailored our practices to be what we like it to be.
Exactly.
No, I agree with you. It's interesting because we had a dip in applications overall in the profession in the last 4 years since COVID. I really think a lot of that's due to the fact that shadowing was out of sight, out of mind for a little while. So we're ramping that back up. But if you don't shadow, how do you know what it's about?
Yeah. And I think that's the biggest challenge our profession is facing, just general knowledge. We've come so far. It used to be, I'm a podiatrist. Oh, you treat kids. Now at least people know what it is. But a lot of these, even at some of these recruiting events, when they come up to the tables, it's like, oh, what's podiatry? And it's like, or they don't know, oh, you can write prescriptions. Oh, you do surgery? So I think just that education on some of these students that are interested in medicine, it is such a great option, because a lot of these students want to go into medicine because they want to be surgeons, right? What they don't realize is that the majority of them are not going to end up getting a surgical residency. I think it's more than 50% end up being, and that might be what they want to do. But if you go in wanting to be a surgeon and then you can't be, you've already spent 4 years and hundreds of thousands of dollars. That's where I think maybe some of the unhappiness or the resentment comes in. But for us, you go in wanting to be a surgeon, you're a surgeon. That's it. You graduate in 4 years, you are a surgeon. You're going to get a surgical residency.
I think also the balance between graduating students and entry-level residency positions in our profession, we work really hard so that everybody has an opportunity and people aren't left out in the cold as you might be otherwise.
Yep. And going back to my dad, I think that was one of his biggest accomplishments as the dean at the Ohio College of Podiatric Medicine. Was he worked so hard. I think they came up with 6 or 7 different residency programs during his tenure there. And that was his goal. His goal, we have 105 students. I want a residency slot for every student. And it came pretty close. And now we have that equilibrium, thankfully.
The pendulum shifts every 15 years or so. But right now, if you come into podiatric medicine, there's going to be a residency position available for you. Yep. And then all the other cool thing I think about our profession is, as a 4th-year student, you get to travel and see the best of what our profession has to offer geographically all over the country. Yep. That's so cool. It's part of the benefits of having a small profession. Yeah. Joe, your thoughts?
No, I don't think I have any additional things to add. I think she answered it perfectly. I do have a new question for her.
Yeah,
We can shift a little bit.
Absolutely.
So you had mentioned a couple people in terms of mentors, obviously family members as well.
Sure.
And I don't know if when you said Uncle Josh, if he was actually like biological or just uncle in the sense of a network, but if you could talk a little bit about some of the mentors that were pivotal for you in terms of different points in your life. And they don't have to all be medicine, but if there are people that you touched your life.
Definitely, my dad's group of friends, my uncles, the majority of them were podiatrists. One particular podiatrist, Josh Gerbert, we would vacation with them. We'd go see them. He is in San Francisco. I think he was initially involved with the school and then primarily involved with the residency program there. But yeah, he was super influential. Even when I was, in my third year and doing rotations and going all around the country, I met just some amazing, amazing people. Absolutely. As for my best mentor, definitely my residency director, Mark Hardy. He was such an excellent teacher, and that's what I tell my students when I'm like, okay, you're going out to your fourth year rotations. What you want to look for, all of them get their numbers or they wouldn't be accredited. How much of the surgery is that resident doing? Because it should be skin to skin. Mark would scrub in and stand there in the corner like this, and he'd just be looking, and he'd step in if you were about to make a mistake, but it was you. Right off the bat, it was you doing the whole procedure skin to skin. And that's why I think I felt so prepared. And even after getting out and going into practice, when I was in private practice those first 4 years, I would still email him, hey, here, can you take a look at this x-ray? What do you think I should do?
Yeah.
But he was just such a good problem solver, such an excellent teacher, and just the best temperament. I don't think I ever saw him lose his temper. Never once.
Fantastic.
Yeah.
He's a good guy.
So, Jana, thank you for taking time out of your
Sure.
busy schedule. I know we even arranged some of your clinic to do this, so thank you.
Sure, no problem.
And any last words?
No, thanks for having me. This has been fun.
It absolutely is fun. It's kind of different. It's a beautiful studio.
This is awesome.
I would say 90% of these podcasts we do on Zoom because people are out of the geographical area, but it's always fun to come into the studio.
No, this is great. First time I've ever done anything like this.
That sounds good. Joe, any last words?
I do have one last question.
Oh my gosh, I don't mean to cut it off.
Just because we don't always have the opportunity to ask a strong female surgeon some questions.
Absolutely.
A common question I know you get, that I get, when's the best time to have a family?
Yeah, and thankfully, I think, well, I would like to think that's changed, but we have heard even recently some of our students getting pressured during residency interviews. Are you planning to have another baby? Are you planning to have a baby? You should not get pregnant. Me personally, I was pregnant when I first started podiatry school, and I got pulled aside by some of the faculty and said, we think you should step down to a 5-year program. And I said, no, why? And, I graduated valedictorian in my class. Like, they were just like, the academic load is too much. It's going to take away too much of your time. No, it's not. Especially, having the support around to help is essential. And so I would say to those students that are considering it, go for it. If you want to have a baby. But make sure you hopefully have that support so that, when the baby's sick, maybe grandma can watch the baby, or maybe your neighbor, or you have a nanny or whatever. And same thing with residency. Women get pregnant all the time. It's a natural part of life. If you're ready to have a baby in residency, go ahead. Personally, you get paid medical leave when you're a resident rather than a student. And you can easily make up that rotation or that time that you missed at the end of your 3 years. So it always bothers me when I hear our students say that they get asked those questions in residency interviews or by their fellow residents. I think that's so wrong.
Yeah. And it's interesting because, as we've talked about trade-offs, I think your point is it's very individual. Like, if you're the kind of person that's like, no, I don't need to take time off. Like, I can manage this. Then you're going to be the type of person that's going to figure it out.
Yeah.
But if you're not, it's also okay. Like, go to a 5-year program. Yeah. Like, it's not the end of the world. Like, if this is something in your timeline, that this is the time that you feel is right to do it, this shouldn't be a barrier. Like school shouldn't be a barrier. Residence shouldn't be a barrier. But do realize what choices you've put into your lap to manage. Yeah. But that shouldn't be, again, everyone should be free to make those choices. So it's just nice to have somebody be able to comment on that since.
And I think it's a little easier now because we have the technology. You can sign in through Zoom. You can watch your recorded lecture. You can, if need be, like during COVID, take your exam remotely. So I think it's easier now than it ever was when I was in school. And I think that's a great thing.
I think that's a great story. You had a baby and you're the valedictorian. Say no more.
Right?
I mean, mission accomplished.
It's doable. It's doable.
And then, again, I think it really comes down to the person. And I did not have kids in school or residency. And for me, having my first child was a very challenging experience. And you don't know that. You don't know how you're going to handle these things. So I think the thing that's so hard is to, these broad strokes of, not one thing will fit for everyone. So I loved your statement of like, if this is what you want, like you can figure out how to make it work. And if this is not what you want, then don't make those choices. But it shouldn't be this external factor. It's an individual factor.
Absolutely.
And then having people to reach out to okay, how did you make these work? Oh yeah, we got a nanny, we did family, or however the strategies that you can then put into place, and asking those questions of people that you feel comfortable with to have those experiences, and mentors that you can have support from. And you had strong male mentors that were supportive.
Oh,
and
definitely.
These are the things that are important. So I appreciated your comments on that when we had conversations before. So I wanted to highlight that for the audience that might be having those questions.
Absolutely. And they're having the questions.
Absolutely.
It's good to put it on the table and discuss it.
Yeah.
And I have to commend both of you for being such great mentors, because we have students when they get pregnant, it's easier for them to come to you, obviously, than it is to come to me. This wonderful experience of giving them mentorship and sharing that you both made it happen and everything's great. It's just, it can be done.
Yeah.
Absolutely.
Yeah.
That's a great way to end.
There you go.
All right. Anything else, Jana, on your end?
No, thank you so much.
All right. Well, to all of our listeners out there, if you're listening on Apple Podcasts or Spotify, please give us a 5-star rating. We're so excited to have Jana on the show today. Jana, I've got one of these cups waiting for you at the office.
Excellent.
It says Dean's Chat. I imagine you'll find something to drink out of it. And if you're watching on YouTube, by all means, become a subscriber. And until next week, everyone, cheers.